Dear friends, myself Dr. Mukund Patel, consultant physician and rheumatologist, Ahmedabad, Gujarat. Today's video is for general practitioners and doctors who are very busy in practice and they don't give more than 5 minutes to patients. Rheumatoid arthritis is a very common rheumatological disease and incidence is almost 1%. So in 100, 1% is having rheumatoid arthritis. So it is very important for general practitioner to understand this disease, to diagnose it and to refer the patient at proper place. So today my job is how to diagnose rheumatoid arthritis in just 3 minutes by asking 3 questions only. First question is, ask patient how is your morning. If patient say no doctor, I am not able to stand up from my bed when I awake and I require a few minutes or hours to do my routine activities, like for female just holding jhadu and making roti, and for male doing routine activities, then it is suggestive of rheumatoid arthritis. If patient says he's having his morning is not good, then you just press his hand by doing seconds, and by this way you are checking his interphalangeal, metacarpophalangeal and wrist joints, and by doing second, if patients say oh and if pain occurs, that is suggestive of tenderness of these hand joints, and that is also suggestive of rheumatoid arthritis. So we have now seen a patient is having morning stiffness with joint tenderness of hands, and which is if it is bilateral, and then check other joints by pressing elbow, by pressing shoulder, by pressing wrist, by pressing knee and by pressing foot, and if tenderness is there, then your diagnosis of rheumatoid arthritis is almost certain. Ask patient how you are after seeing a movie or sitting for prolonged time for more than 3 hours. If patient say after 3 hours I can't stand up suddenly, I am stiff for few minutes. If he is having stiffness lasting for more than 30 minutes, that is suggestive of stiffness. It is just like morning stiffness, and it is also suggestive of rheumatoid arthritis. Then what is the next step? Then you ask certain investigations like complete hemogram with ESR, with SGPT, SGOT like LFTs, serum creatinine. Then you ask for rheumatoid factors, and if patient is affording, then you ask for anti-CCP antibodies. If rheumatoid factor is more than 1/80, ESR is more than 50, and if anti-CCP antibody is positive, means more than 15, then it is a certain case of seropositive rheumatoid arthritis. If rheumatoid factor is negative or anti-CCP is negative, then it is not rheumatoid arthritis like that. It is also rheumatoid arthritis, but it is seronegative rheumatoid arthritis, and treatment is almost same. So what is the next step? If you are aware of and you are knowing the treatment, then you start disease modifying anti-rheumatic drug, that is known as DMRD, as early as possible. And if you are not knowing side effects, then you refer this patient to a physician, rheumatologist, not to the orthopedicians, because it's not his bread and butter. So better to refer this patient to a medical person. It's a medical disease, it's an inflammatory disease. So treatment starting DMRDs and onset of disease, if duration is minimum, then the prognosis is good. So meanwhile you start NSAID, that is non-steroid anti-inflammatory drugs, and meanwhile you make the patient pain-free. You can give low-dose steroid also if not contraindicated. Then you refer the patient for DMRD. So there are so many DMRDs are available. Even now biologicals like TNF blockers and advanced treatment is also possible. In near future, with the newer and newer biological drugs, in future this disease may become curable. But meanwhile your job is to diagnose rheumatoid arthritis early, fast, and refer to the proper person. Thank you very much.